Are you a casual worker and do you work in the health industry? As part of the budget, the state government has announced it's stopping sick pay for casual workers from the 30th of June. It does seem to be a blow in particular for healthcare workers, many of whom are casual. Paul Healey is the State Secretary of the Health and Community Services Union here in Victoria. Good morning, Paul.
Good morning.
How many people who work in health or community care are employed on a casual basis?
On average, it's about 25%, but in our membership, which is disability, it's as high as 40% of people are working casual. Because of the way the NDIS is funded, a lot of the wages and conditions have now been withdrawn, and so workers are on more precarious wages, and so predominantly it's affecting them. So it's a real problem for the vulnerable people they work with.
So what's your reaction to this news that sick pay is being cut for all casual workers soon?
Look, we thought it was a very brave decision of the government to do this and to lead the way, and we're very disappointed. We think that it's going to mean that workers have to choose between eating and paying their rent and looking after their family or going to work sick. And people, it's tough times, the economy's hard. It's going to mean that people are going to go to work sick, which is going to really affect the vulnerable people in Victoria. Nobody wants to spread their germs around, but they're not going to have much choice.
Well, I wondered about that as well, if there could be a bit of a downward spiral, because we have, of course, COVID hasn't gone away and a lot of people are still getting sick with it and other respiratory viruses. Could there be a bit of a downward spiral here where people, because they can't earn money and put food on the table, they go to work sick and then spread it and make the problem worse?
Well, absolutely, and that's what we're going to see. During COVID, when people didn't have to go to work and they had support to stay home, we saw a very low rate of infection in disability houses, and there's potentially going to be a big rise. And there is still a lot of workers off sick with COVID at the moment, and it could really be a real spread.
You're listening to Paul Healey. He's the State Secretary of the Health and Community Services Union. Paul, there will be people that say, well, tough cookies, casual workers already get a 25% loading, and that is to cover sick pay to begin with. What would you say to that?
It's also in lieu of holidays and other things. I think people haven't got a choice, really. It's got to work flexible hours enough to get enough work, so they are casual. A lot of people would rather full-time work, but oftentimes in disability it's not available. On
behalf of your members, 40%, almost half, is a very high number of casual workers in the disability sector. Are you working to try and get more of those people more permanent work?
The real issue is the funding out of the NDIS. It does not pay for staff to be fully funded. So there is this sort of cut in wages and conditions. We really believe that, for stability in a person's home, you need to have regular and systematic staff there. We'd love to see the rosters built strongly and have full-time and part-time work that suits people so that they can actually do the best and have the best outcomes for the participants in the scheme.
And looking more broadly, a lot of more funding was given to hospitals across the state, but you've noticed perhaps that mental health might not have been such a winner in this budget?
No, there's only an increase of 25 million. We thought after the Royal Commission we'd see, continued growth. Mental health has been neglected for more than a decade before the Royal Commission, and we've seen some significant investments going forward, but that seems to have been pulled back. There's still worker shortages. There still needs to build staffing profiles. We were hoping to see the expansion of hospital in the home, which has been a trial at Barwon and Origin, which have been very successful. And we were hoping that the budget would really boost hospital in the home so people get treated where they're most comfortable and bring that support to people in the community, so not to disrupt their lives.
Paul, thanks for your time this morning.
Thank you.
Paul Healey there, State Secretary of the Health and Community Services Union. And on sick leave, no longer being provided for casual workers in Victoria, Roisin says it's so risky for disability workers to not have paid sick leave, especially gig workers. We shouldn't make them choose between going to work sick or staying home and not being able to pay bills. This is dangerous for workers and for clients. Thank you, Roisin. Yes, the focus has been on the workers, but of course, when we're talking healthcare workers, about 1 in 4 are casual. Quite often their clients are vulnerable, aren't they? And is it a good idea to be encouraging them to go to work sick? Wouldn't have thought so.